Main Street Animal Services of Hopkinton, and I'm Margo Roman, and I'm main veterinarian here. We have two other veterinarians that work with us and have a complete holistic health center in our lower level, which has two chiropractors, a physical therapist, massage, cranial sacral, polarity, and Reiki in the lower level. And on the upstairs up here in the main clinic, we are doing homeopathy, acupuncture, nutrition, and conventional, traditional, integrated veterinary medicine. So one of the reasons for making this videotape is that I found that after several years of doing a holistic intake, I was repeating myself with some of the same issues, and I really wanted to spend more individual time with you and your pet versus giving you some of the basic introduction to why we are trying to achieve a different level of health with this type of alternative medicine. So well, why I decided to study homeopathy is I've been a veterinarian since 1978, and I did my internship at Angel Memorial Hospital where I did acupuncture, which they wouldn't let me do, but I ended up doing acupuncture there. So I took the veterinary acupuncture course in 1976 and have been doing acupuncture since then on and off. But what made me decide to study homeopathy, and we'll stay in that area right now, is about 9 years ago, I was going on a camping trip, and I was hugging my dogs goodbye, and I could feel myself getting poison ivy. So I started to go upstairs and started scrubbing my arms to try to get any of the oils off and stuff so I wouldn't get poison ivy. And I had a homeopathic first aid kit that I had bought about 10 or 15 years before and had dabbled a little bit in it, but I really didn't understand how it worked. So I went ahead and started taking some homeopathic remedies, which were for poison ivy, and kept taking them, and it got worse and worse and worse. I kept taking the remedies, it kept getting worse. And literally, it was at the point where my arm is from here to here, on both of my arms, was completely covered with poison ivy and oozing and dripping, and both arms were just so inflamed. And I kept taking the homeopathic remedies, and it kept getting worse. So I talked to forest rangers up in Canada. We were camping, and they said, soak it in the hottest water that you can. So I did that, and it kept getting worse, and I kept taking the remedies. And I thought, oh my gosh, I really, if I had been here in Massachusetts, I would have gone on steroids and antibiotics, no question asked. And it was that bad that I thought that I was getting a secondary cellulitis. But I decided to stick it out because I hated going on antibiotics because I end up with secondary yeast infections, and I just figured it's better if I don't have to go on the antibiotics. Well, in any case, this poison ivy, was getting worse. But I came back to Massachusetts after 2 weeks. My arms were still red, and I meant to say that I have asthma as well. So I was using the inhaler 2 or 3 times a day while this was going on. I had had asthma for years. And as soon as the redness in my arms went away, my asthma completely stopped. I had stopped using my inhaler, and I thought, oh my goodness, what just happened? I don't even need an inhaler anymore. And I kept thinking, well, it has to be related, because to have the redness in my arms go away and then my asthma completely go away, I just thought there had to be something to it. So I started to read anything I could find on homeopathy. So I kept getting books and reading them, and then they were opening up the first accredited school in New England, and I decided to go ahead and take classes from Dr. Luke DeShepper. It was called the New School of Homeopathy, which is now called the Renaissance Institute of Classical Homeopathy. So I signed up for the class, and in the first lectures that we had to read, and the presentation that we had to read, we read about the laws of Herring. And so this whole thing with the healing, where your body is pushing things to the surface. So I started to think of this as a possible, issue, is that we've got to get the body to heal it. And I thought, well, I can learn homeopathy pretty quickly. I taught at Tufts for about 7 years. I was at Harvard at the Primate Center before that. So I sort of knew, I figured I could figure this stuff out. It's not going to take me that long to figure it out. Well, in all this reading and stuff, I realized it was a lot bigger than I ever thought it would be. And I've been staying in it for 9 years now, and probably will be in it for another 10 years because it's an endless kind of information. But the interesting thing about the poison ivy is about 3 or 4 months into my study, I'm driving into Boston listening to National Public Radio, and they had the head of pulmonology from Brigham and Women's on NPR talking about all the new asthma protocols and all the new medications that were available for patients to use. And someone called in, and this person now is the editor of the New England Journal of Medicine. So he is someone who we would respect in his research and his ability to discuss the level of medicine that we think is the highest level of medicine. And so someone called into him and said, what does asthma look like histologically? Meaning, if they took the lungs and they did a cross-sectional piece of the lungs, what would it look like? And he responded that it looks like poison ivy in your lungs. So that response of seeing that the body was dumping it to the surface, it made me realize that, wait a second, there's something very, very powerful in this homeopathic remedies that is making the vital energy or the strength of the body be able to push it out to the surface. And after this thing happened, I didn't get a cold or an upper respiratory infection for 2 years. I wasn't sick one day for 2 years. And to me, that was so phenomenal that it has made me really feel that it's the way that we need to address medicine. We need to let the body try to heal itself before we are constantly intervening with drugs and steroids and antibiotics and antihistamines and more drugs and more steroids and more antihistamines, and we've seen such great results with animals that we've approached this way that it's really worth putting them through this healing episode or healing crisis that they can go through so that they themselves can heal from the inside out. Were very functional and very well known in the Boston area. And in 1920, when penicillin was developed, they decided, they found the magic bullet, we can close these places down, the homeopaths are all quacks, we know how to cure all disease with our new drugs. And they basically did shut homeopathy down in the United States by the discovery of penicillin. But prior to that, in the late 1800s and the mid 1800s, homeopaths were really against bloodletting. It was just, you don't drain out the body's vital energy. You allow the body to use it to heal as much as you can. But the AMA and the conventional practitioners felt bloodletting was the state of medicine. Like the state of art of medicine was to bloodlet. And the homeopaths at that point were considered quacks because they would not bloodlet, and it was a big strife between the whole homeopaths and the allopaths, and that's when the American Medical Association was developed, was because of this whole thing of bloodletting. They were trying to condemn the holistic, the homeopaths versus the allopaths. So homeopathy has had a long history in this country and in Europe it's very much standard. I mean, you can go I was traveling through France, and every pharmacy has a section for homeopathy. There are homeopathic pharmacies all throughout, and also in Germany and Italy too. So it's been there for a long time, but it's getting to be part of what we accept in this country as a good way to start our treatment versus the last thing to do for treatment. So if we can initiate the body's own energy to try to heal itself, why not? Instead of intervening with different drugs that may very well have serious side effects and even fatal side effects. One of the statistics that was that I recently heard, that it was 46,000 people in the United States die from drug-related incidents, meaning prescribed medications by physicians, and on the flip side, only 100 people have died from, herbal or holistic or something. So it's a huge difference in the number of people and number of, issues that have been affected. And we know the drug companies aren't as ethical as we'd like them to be. So, having a drug that's been proven this week and we know that is really, the top of the line, and then 6 months later to 3 years later it's pulled off the market, and all the studies that were done were considered invalid anyway. Homeopathy has had provings that have been in these books for 200 years, or at least 150 years for the Harrian's books and stuff. So it's really important that we keep this in the forefront of the way that we practice medicine, and it should be our first choice versus the last thing that everybody selects to do. So. And for those of you that are not familiar with homeopathy, homeopathy is like cures like. You give a small amount of a substance that the body may or may need by working it up, and the body changes in a direction to try to heal itself. For instance, if you cut a red onion, what happens typically? Your eyes run, your nose run, and then after about 3 or 4 minutes, your eyes stop running and your nose stops running, and your body knows what to do in that situation. It corrects itself. If you had those same symptoms from a cold or some type of an allergy, most people would take Benadryl or Contact or Claritin or Atarax or some kind of antihistamine that would try to dry up their eyes and dry up their nose, but there's side effects affected, when you take those medications. Instead, you would take a homeopathic dosage of red onion. Your body would sense that there's red onion in the system, and it would change to bring it towards balancing itself out. Instead of giving you something that is just suppressing the reaction, your body responds to it in a normal way that it has always done for whatever time we've had humans in the world here, because the body knows certain materials, knows certain plants, knows certain minerals that it can respond to normally. Now, in homeopathy, which was discovered by Samuel Hahnemann about 200 years ago, and he was a German physician who found that if you used small amounts of a particular element or product or remedy that we would use instead of large amounts, he got a better and deeper response, and the people didn't get toxic from the particular substance. So he proved many remedies in his books, and since that time there have been so many other homeopaths that have also taken remedies and proven them, and in a way that they've taken at least 50 people and proven these remedies to get these same symptoms so that we know which ones to use. So when we try to work up your animal, we try to look at all the possible remedies by putting it into a very in-depth computer program and looking at the intake sheet that you will be filling out when you do your appointment, and so that we can look at that all the parameters of your animal and to be able to tell which is the best remedy to use. In homeopathy, there are one of the main ways in which it works are the laws of Hering. And the laws of Hering are the way in which the body heals. And the deepest problem is your mind and your mental, and more serious levels in your brain. The next is your lungs, your liver, your pancreas, your kidneys, your more deeper organs. And next is your intestines and your bones and joints, and next is your skin. So to allow the body to heal and move things to the surface is the way the body is supposed to heal, is to try to bring it from a deeper area to a more superficial area. So when something comes to the surface in a homeopathic cure, when we're trying to go, we're actually very happy about that, because the body is bringing it to the surface versus letting it go deeper. Because with the way that we feel in holistic medicine is that it's like the way we treat disease in conventional medicine is that we have a problem and it comes up and you treat it. You come up and you treat another problem. And you're not really solving the root of the issue. And it's like analogizing to having weeds in your garden, and every time the weed pops up, you take your scissor and you cut it off, and you cut it off, and you cut it off, and you're chasing this all over the place without dealing with why are you developing these roots, why are the problems there, and dealing with it at a deeper healing level. And that's what, when you do alternative medicine and you do the holistic approach, you're trying to deal with the deeper parts of the problem and not just chasing after a little bit here, a little bit here, because you're going to have a skin problem here, an ear problem here, and an anal gland problem here, an interdigital cyst here, and you just keep chasing these weeds, and you never really deal with why the animal's having the issue. So in homeopathy, again, you're going to be giving a small amount of a substance that may or may not appear to be toxic in a high dosage, and it makes the body think that it's exposed to it, and it goes and changes to a cure. Now, if in homeopathy, again, we're going back to the laws of Hering, we know that if you had an abscess on your arm and there was pus coming, you wouldn't want to push the pus back in. You would want the infection to come out of your body. And so allowing the body to get rid of it on its own is what you want to achieve with a healing crisis or healing issue with your animal. It was developed in China, and for the last 2,000 years it's been actively used as a way of medicine. In China, it's very standard that people will have acupuncture and TCM, or traditional Chinese medicine, which uses the Chinese interpretation of the body and the health of the body. So at this practice, we will also possibly incorporate acupuncture and some Chinese herbs and other herbs as well to help the body heal. And the acupuncture, just to go through a little bit about acupuncture, the body has meridians, and those are energy lines that run through the body. And these energy lines are almost like electrical circuits that run through the body and come down, and the energy is pushed through along certain points. Now, if there's like a particular problem in the back, that energy is not going through that back, so it's stopped there. And what we'll do is put needles in, or put. I also use what's called aquapuncture, which is using a B12 injection at the site. Or we also have a far infrared laser light that we can use instead of needles, to use light to bring it through. And sometimes I'll integrate in the acupuncture if I feel that is the issue that's most compromising to the animal. You know, for instance, if an animal is extremely lame or becomes extremely sore or has severe dysplasia and we can't get it up, it's more important that I get them off the pharmaceuticals and get them moving around and feeling good. So we'll go ahead and use acupuncture to get them to move forward. It works great for a lot of serious physical issues, including kidney failure, severe kidney failure, and we'll use it and integrate it in when we need to. So this is another photo of some of the bladder meridians along the back of the animal, and how they are really, there's so many of them, and to know all the points and to know where they are and how they integrate with each physical system of the animal, in Chinese terms, is called traditional Chinese medicine. The acupuncture needles are very, very tiny. They're small little needles that are almost hair-like, and you know, most people don't even know they're going in. You might get a small sensation of the needle, but it's very, very small, and the dogs seem to tolerate it pretty well. Some cats have a little more difficulty with it, and if we need to, we can use the laser light as well, but the needles are very small, so they usually don't have a problem sitting with the needles or dealing with that. But again, another option I talked about was doing the aquapuncture, which is using some type of an injected vitamin. I usually use B12 into the point, so I get the advantage of having a B vitamin, which stimulates appetite, stimulates red cell production in the acupuncture point. So I'm getting like a dual kind of effect of doing the acupuncture. Animals to be eating properly. Everybody knows that what you put in your body is what you get out of your body, and if you put crap in, you're not going to get much more than crap out. You know, it's really pretty much down to that. You need to give good quality ingredients, you need to give fresh quality ingredients, you need to give raw ingredients, so that the animals can eat what they were evolutionarily designed to eat. Feeding a raw diet and feeding fresh foods makes logical sense, that you don't give something that has a 2-year shelf life with preservatives and dyes and all the other things in it, versus something that is healthy and fresh. But making sure that it's balanced and it's the right amount for each animal is very, very important too as well. So it has to be looked at in that total picture. In feeding a raw diet, you have to always be careful when you're handling raw meat, and is that it's handled very carefully, like you yourself would handle raw meat. So you've got to be careful about making sure that it's not dripping onto your counters and on your lettuce, or you have young toddlers that will be eating it as well, and you don't want to do that. So you've got to make, when you do decide to switch to a better diet, and we probably will include some raw meat and raw vegetables in the diet, we want to make sure that you are addressing the fact that it is raw and it will spoil and it does have more bacteria, because animals were designed to eat bacteria. They will eat dirt, they will eat, another dog greets another dog. The first place they go is they check out their rear end, and they don't, they'll eat someone's stool. They can eat a lot of bacteria, and their bodies were designed to eat this bacteria to make them be accustomed to the diet. Now, in feeding a raw diet, I want to make sure that people know that this is what the body was designed to eat. You know, they have enough acids in their belly, I mean in their stomach, digestion, to be able to take that raw diet and not be a shock to the system. So when you do start out with a raw diet, you really want to go very slowly so that you don't do that shock to the system, because the body's not used to it. A book that came out about, well, actually research that was done in the 30s, and the book that came out in the past 10 years or so is Pottinger's Cats. And it's a study that was done in nutrition for humans, but they used 2 colonies of cats. One they fed raw milk, raw meat, and raw vegetables. And the other one they fed cooked meat, pasteurized milk, and cooked vegetables. So they had 2 separate colonies, and after 3 generations of feeding these separate colonies as the foods, the ones that had eaten the processed food with the pasteurized milk, the cooked meat, and the cooked vegetables had more incidence of irritable bowel, diabetes, joint problems, and arthritis, and their intestines was longer than the other group. So this is 3 generations of just seeing the changes. And so when you look at our diet as humans, most of us eat so much processed food. And what are our major problems that we have besides arthritis? I mean, besides whether cancer and heart disease, is arthritis, irritable bowel, and joint problems, and diabetes. So it's very important to have in your diet a lot of fresh foods, and it's very important for animals to have a lot of fresh foods. So we want to, you know, that's something that it's been in controversy in nutrition right now in the conventional sense, because so many of the conventional veterinarians are only educated by the dog food companies that make processed food. So where is their bias going to be? Their bias is going to be educated by the people that sell the processed food, not the people that are selling the raw and fresh foods and designing those. So we have seen such a major difference in doing diet changes. So when your animal comes in, we will look at the whole picture. We may decide that we're not going to use raw diet at this time. We may decide that we're going to use certain proteins at this time, meaning that certain proteins are warmer than others. So we want to use cooler proteins for animals that have you know, certain issues. So that will be decided when you come in, when we look at the whole history of your pet. So concerning other things that we would probably end up doing here is trying to add some nutraceuticals and nutritional support to get the immune system sort of working for us. Because many of my patients that come in have been to a lot of other veterinarians, have been way over vaccinated, and have been way over medicated. We have 400 species of bacteria that live in harmony in our bodies. They all work together. They all work in our mouth, and our intestines, and our liver, and our kidneys, and everywhere on the surface of our skin as well. When we go on an antibiotic, how many of those have we destroyed just because we put an antibiotic in the system? I have no idea, but you are damaging the body. You are damaging the body at some level, and many, many times you do not need antibiotics. I used to use antibiotics 4, 5, 6 times a day when I was in doing only conventional medicine. I use it now once every 6, 7 weeks now, and I get same response, actually better responses. So to always depend on antibiotics to help you heal is the wrong way to look at it. Your body can heal without them, and it needs to be strengthened versus just suppressed with antibiotics and medications. So some of the stuff that you probably will get will be a nutritional support to help clean the body out, to help support new intestinal flora, which is a probiotic, and depending what your animal needs, we will decide which one the animal will need. And so we do try to nutritionally support it, and that's you know, something that we may maintain the animal on for weeks, or we may maintain the animal on for months. So it really depends on each animal's condition and what we want to achieve with that particular pet. So I'm hoping that this video will help you understand a little bit of why we are trying to go down this path of increasing your animal's own vital energy, its own immune system, so that we can get it to work for us and work for itself to heal. We again are located, we have our website, which is mashvet.com, M.A.S.H.V.E.T.com, and you can check there for the map on how to get here. And there is a form in there that we make sure that everybody comes in and has that filled out, so that it helps us with an understanding of the animal more in depth than asking you questions. Because again, by doing this video, I really wanted to try to spend more time individually with the animal and working it up, and the introduction part has been done already. In the practice, we have this whole holistic health center that I mentioned that is downstairs, where we have chiropractors, physical therapy, massage, Reiki, craniosacral, polarity, and it really is enhancing to the animal's immune system to get some of these adjunct modalities to help the animal heal. We also are a full-service veterinary clinic. We have surgery, and we have supportive food therapies and other conventional vaccines and everything, but we use the vaccines very carefully. So I want to thank you for watching this video. It'll save me some time and give me more time to spend with you and your pet, and we'll be able to try to get your animal to reach the full potential of health. And that's what we're looking for, is to find a way for you to understand why we want to do this and to be able to help your pet heal as much as possible and stay healthy. Thank you very much.